Hi guys, today we're going to talk about something called right-sided fibromyalgia. Now what is that? Well, in the last 30 years of practice, I noticed the majority of clients coming in with fibromyalgia nearly always had it on the right side. Okay, now why was that? That was weird. Why would you have it just on the right side and not the left side? Okay, well, I found when I started pulling the string that the real cause for this condition is the gallbladder, which happens to be on the right side. Now there's a little nerve that comes right here called the phrenic nerve that can refer pain to the right shoulder, to the neck, all the way up on the right side, and it can even affect your meridians. Like in Chinese medicine, there's these nerve channels called meridians, and that can affect the entire right side, even lower on the leg as well. So anything on the right side, you always want to check the gallbladder. So if you have right-sided pain right now, do this simple experiment. Take your hand, press underneath the right rib cage, about an inch down, an inch from the midline, and just start massaging that for about a minute. And you will soon find out that that pain completely goes away. Why? Because the root problem is the gallbladder. Okay? If you research fibromyalgia, you're going to find they don't know what causes it. It's an unknown cause. They don't know how to fix it, but check the gallbladder. Okay? Now the question is now, what would aggravate the gallbladder? Number one, frequent eating, like eating 6 meals a day, snacking continually. Why? Because it keeps aggravating the digestive system. It has to constantly work. That's why going on intermittent fasting is incredible for improving gallbladder function, because you're taking all the stress off the gallbladder. Number two, consuming nuts can aggravate the gallbladder, okay, and make you feel bloated. Too much sugar, refined grains, even whole grains. Cortisol, that's from either prednisone, a medication, or just stress, can aggravate the gallbladder. High levels of estrogen can aggravate the gallbladder and cause stones. Whether you're on birth control pills, hormone replacement therapy, or just got pregnant, that can do it too. Low-fat diets can actually create stones. Consuming saturated fats actually stimulate the release of bile that actually prevents gallstones, okay? And that's why when you go on a low-fat diet, you can end up with gallstones. So a low-fat diet can cause stones in the gallbladder, but a high-fat diet can also aggravate the gallbladder, but not necessarily create the stone. And that's simply because saturated fats tend to stimulate the gallbladder to release more and more bile. But there's a high risk factor for gallbladder disease for diabetics simply because sugar aggravates the gallbladder. So if you look at some of the remedies for fibromyalgia, which is an inflammatory condition in your muscles and connective tissue, you're going to find this common remedy that seems to be effective called malic acid. Okay? Now, why would malic acid help fibromyalgia? Because it supports the gallbladder. It helps soften stones. It increases the bile duct. It vasodilates the little duct to allow the sludge from the gallbladder to drain out. It's the compound that is tart in apples. And take a wild guess where you can find malic acid. In apple cider vinegar, another great remedy for fibromyalgia because it supports the gallbladder in the liver. So if you have a gallbladder problem, apple cider vinegar is what you need to do. Infrequent eating, that's called intermittent fasting. You need to do keto, adjust the fats to your tolerance. You may need to take some purified bile salts. Okay, I put a link down below for more information about that, especially if you don't have a gallbladder, because you don't have enough bile to break down the fats. Or choline is another thing you can take to support the breakdown of fats, and this is really good for a fatty liver. So I believe that fibromyalgia is really a secondary condition, a symptom of a congested gallbladder. Thanks for watching. Hey, I appreciate your attention, and if you're enjoying these videos, go ahead and subscribe, and I will definitely keep you updated on future events, live events, and webinars that we're going to do very soon.